Hi everyone, thank you for joining us for today's Residential Aged Care Cost Collection 2024 webinar. My name is Sophie, I'm a Project Manager at IHACPA in the Aged Care Costing team, and joining me today is Lisa Federo from the team at Health Consult. Before we get started, I'd just like to acknowledge the traditional custodians and the many different lands on which we're meeting from today and recognise their continuing connection to land, water and culture, and we also pay our respect to elders today and those who walk in spirit. Before we get started, just a few housekeeping bits. So the presentation will go for about 30 to 40 minutes and there will be time for questions at the end. So on the right-hand panel, there should be a live Q&A box where you can submit your questions. And if you do have any technical issues on the platform, there should be there should be a live support icon on the top right-hand corner, and the virtual team can assist you with any issues. Also at the very end, there will be a short polling question, so if you could fill this out, that would also be much appreciated. And the webinar will be recorded. So after the webinar, there will be a link sent to everyone so you can rewatch if there's anything that you missed out on. Next slide, please, Lisa. So in this presentation, we'll introduce what the Residential Aged Care Cost Collection 24 to 25 is and what it involves. So as a provider, what participation would look like for you. And we'll also share some lessons from the providers that participated in phase one. So this cost collection started last year and we've already recruited about 120 facilities that have participated, and we're now extending the study into 2025. So we'll hear from some of the providers that participated last year. And as mentioned at the end, there will be time for some questions. So what are aged care cost collections? So essentially, one of IHACPA's functions in aged care is to provide pricing advice to the Minister for Health and Aged Care. And for residential specifically, we provide advice through the ANAC funding model. So the cost collections allow us to better understand the resources used to deliver aged care services and how much they cost, so that our pricing is evidence-based and it can be as accurate as we can make it. So for our pricing to be truly representative, we need to collect data from a diverse range of aged care providers and residents, and this includes providers of different sizes, geographic areas, operational models, and as well as residents with a different range of care needs or ANAC classes. So we completed our first residential aged care cost collection in 2023, and we did kick off this collection last year and looking to recruit as many participants as we can this year as well. With each cost collection, we're aiming to build upon the data that was previously collected. Essentially, the more data we have and the more evidence we have, the better our pricing advice can be for the Minister. Next slide, please. Essentially, so the benefits of participation. So as mentioned, it will shape the pricing advice we provide. So especially in terms of, different locations like rural and remote providers, we understand, or those providing specialised services might have different costs. So the more data that we're able to capture there, the better our pricing advice can be to be reflective of all the different services. And also, as a thank you for participating, you'll receive a benchmarking and data insights pack. So this essentially gives your home a picture of how you're performing compared to your peers. And with that, I will hand over to Lisa Federo from Health Consult, and she will run through an overview of the cost collection and the progress to date.
Thanks, Sophie, and thank you to everyone for joining to hear more about the Residential Aged Care Cost Collection. The 2024-2025 Residential Aged Care Cost Collection aims to be bigger and better than previous collections. Now, why do we want it to be bigger? Well, as Sophie mentioned, bigger means a better database for which IHACPA can provide government advice on pricing. Now, the study did start in May last year, and we have recruited over 120 providers already. 100 have almost finished their data collection. We have the last couple finishing within the next week. So we are looking for another 100 providers to sign up. We are looking to recruit to have as much of a representative sample as we can, and we know that primary selection criteria is based around the geographic location. So we want a range of MMM classifications. We want a mix of ownership type, and we want all sizes, small, medium and large. We're also looking to recruit providers that have other characteristics which we know may influence the cost delivering services. And so we're looking for those that have the BCT or base class tasks that are focused on specialised services, so homelessness, specialist dementia care units and First Nations people. As we mentioned, it did start last year, and the project is set up in tranches. So in every tranche, we have a number of providers that start in sprints. Each of the lines represent the starting for a provider where there's a live data collection that happens for 30 days. What we're recruiting for now is for tranche 5 and 6, starting at the end of March, and every week we'll have a group of providers that start together and complete the 30-day data collection. But before we get into the details of what it means to be involved, we want to share some of the experiences of some of the providers that participated in 2024. So as we said, every year we aim to improve the collection. And so what we learned from the providers that participated in 2023 was the technology was a bit of a barrier for them. They needed to recharge and charge up devices that became problematic. So for 2024 and the 2025, we do have new technology, which I'll share with you in a moment. But first, we conducted some interviews with some of the homes that have already participated. And we asked them, well, why did you actually participate in the 2024 study? And the answers that we got were, we're passionate about making a difference and informing good policy decisions by the decision makers. We're striving for innovation and wanting to look outside the standard aged care offering. It's good to be part of something that can support, improve the aged care industry. And we were happy to support an important project that will lead to better funding for aged care. We also asked them about what their experience was like with the activity data collection process. And what they said was that the overall process is simple and residents didn't complain about wearing or carrying a card. The card itself is not intrusive. The only challenge is with residents with cognitive impairment, sometimes they remove their card, throw them in the bins or on the floor. Staff also complied with the request to wear the cards during the shift. Another home said that being a small home, the overall implementation was smooth and manageable for our team. Another said, while the initial week presented some hurdles, by the second week, our staff had fully adapted to the new processes. And the last provider mentioned that uploading the data to the portal was very easy, and downloading the files that were pushed to the providers was also easy to download. And then we asked them, what would you say to other providers about participating in RAC 2024 again? And they've said, well, our experiences have been positive with good compliance from staff and an efficient setup and pack-up process. They've said that communication is the key, especially with site leadership. Once they are engaged, they will drive the study on site. Staff do need to be briefed before the study commences, as do the residents and or family, as they will get lots of questions about things like privacy, confidentiality, and how their personal data is used. Another site said that overall it was a positive experience for staff, contributed significantly to the project's success. And the last provider said, ask staff to check residents' clothing before they go into the laundry. We've had several cards found in the washing machines, but luckily they all worked after with a bit of relabelling. So now I want to tell you a bit about what being involved in the collection actually involves. So we've designed the data collection in 4 stages. So 28 days before your go live date is the establishment phase. And at that point, we get confirmation that the site is going to participate. This involves a discussion with head office and also with the site in which you've nominated to participate in the study, and you may want to allocate more than one site to participate in the study. We ask you that you nominate a local site coordinator that can be the contact for the study. And then we also help the site sign up to access IHACPA's data portal. All of these are quite easy processes, and we provide hands-on support to help. You then elect the tranche that you want to start in, so 5 or 6 in this case, and what week suits you to start. We then send out an implementation pack, which has a lot of information, which we will go through with you in the pre-collection phase. So 3 weeks before collection starts, sites are provided with pre-data collection templates. Our relationship managers go through those with you, provide some training with the site coordinator as well as key staff. Then your technology pack arrives, and our RMs or relationship managers come on site to set up the technology. Now, what does the technology involve? We'll get to that. But the 30-day data collection period is an automatic period. Once the data once the technology is set up and the residents and the staff wear the cards, the data is automatically submitted in a de-identified format. We also ask you to provide some supplementary data that actually helps us give a bit more information about, movements of residents during the period and other changes that might actually happen at your site. And our relationship managers provide ongoing and regular support with the site coordinators. Then once the 30-day live data collection is finished, either the site sponsor returns a technology pack or we send out one of the health consult staff that'll pack it up and courier it back to the base for recharge and cleaning and ready for the next site. We ask you to attend a meeting just to discuss some of the things that we've seen through your data collection. And then after about 3 months, after we've got a sufficient amount of data, we'll analyse the data and provide you with your site's feedback report. And then there's the end of study report, which I'll also discuss in a moment. But just to get into a bit more of the detail in terms of what all that data is. So the establishment data I mentioned is really financial data. So it's the QFR and the ACFR, which we are provided through IHACPA. Then the Stewart Brown or any other financial data that you may have, we are also happy to have a look at because it provides some explanatory information that around your ACFR and QFR and some other little bits and pieces. But that's it for the establishment phase. Then the pre-collection, which is 3 weeks before it, we ask for some more information about your site. We want to know how many places you've got, whether you have a specialised focus, the types of units you have, whether you've got any specialised dementia care units, the types of rooms you have, whether they're shared or all single, and whether you have any co-located services with your home. We also ask for a de-identified roster information list. So this just provides us with the number of staff you have by different staff types that will be involved in the study. So your lifestyle officers, the number of ENs, RNs, etc. We also ask for a resident list in a de-identified format. So we ask for either the MAC ID or the aged care ID or the care recipient ID. We have found in the first phase that care recipient ID is easier for homes to identify. Then we ask for the admission date and the residence room number. And this information is used so that we can allocate cards. All this data is gathered through Microsoft Excel templates. These are downloaded from the IHACPA Secure Data Management System. Once you download it, you can populate it. It's got some helpful guides in there and some quality checks, and then you upload it back into the IHACPA system so that we can access that data. And it's as simple as uploading and downloading into sort of a Dropbox feature. So what do we collect during the study? So the time and activity data, so this, as I said, is collected automatically through the technology. So we ask all staff to wear a card, and we ask all residents to wear a card or a bracelet if they prefer. The cards are numbered, they're not identified to any individual. And what happens when a staff card comes in contact with a resident card when care is being provided is it measures the time of the interaction between those two numbers. And that data, as you walk past an iPad, it actually is the hub at the end of the shift, and you put that card back into a box next to that hub. The data automatically uploads, and the cards are cleaned, ready for the next staff member to pick it up for their next shift. We're also looking at collecting information around indirect care, and the way we're doing this is in a couple of ways. So we have beacons, again, which we are putting in staff's offices that actually do work related to residents, but they're not with the residents right in front of them. So these might be the nursing stations, for example, and when the card and the beacon come in contact, the card is on the staff member wearing it and the beacon is already in the office. It measures the amount of time that that staff member is there. And then what we do is we work with staff to actually understand when we have the outputs about what they were doing with that time, which residents were they assisting when they weren't directly in front of the residents, so we can make sure that that staff member's time is allocated to that resident as indirect resident care. At the end of the 30 days, we also speak with the site coordinator about were there any movements during the study that we should be aware of? Did any resident leave for a period of time? Was anyone admitted to hospital and that was why they were absent? And whether or not any residents moved out of the home during that period of time. We do have daily monitoring data. So we do have a dashboard that has, if you've got, say, 30 residents, we should see 30 lights every day. If we don't see 30 lights, the relationship manager will contact the site just to say, look, we noticed card number 25 is inactive. can you please locate the card, or can you tell us has the resident moved out of the residence, so that we can actually remove that from the system. Sometimes that's when we, site coordinator goes looking into the washing machines for those cards. We also ask for any supplementary financial data at this stage. So some homes have had some work done that looks at how what their overhead costs are, what their accommodation expenses are, and there's other expenses related to infection prevention and COVID expenses. And so we gather that information from the site as well. And then together, all that data is used to actually develop a cost per resident. So we take all the financial data and the non-financial data and the timing data, and we apply it using our costing methodology, which allocates costs to both direct and indirect care, and eventually those costs end up pinned to a resident. And then what we do is put that information into a pack that we then come back to the homes to go through it to make sure it all makes sense. Now, just a bit more about the wearable technology. We have spent a lot of time and purchased Contact Herald Bluetooth technology that automatically captures activity data. So this not only reduces burden, but it actually increases the data quality that we're getting. So when a staff member, as I said, is near a resident, the Contact Herald cards or the bracelets, some residents prefer bracelets, using Bluetooth technology, measure how long that interaction is. These cards don't need charging, there's no specialist setup, they can be worn by staff and residents without the need for training, and they don't record any personally identified data. They're not tracking you in terms of location, it's really about interaction and the care that is being provided to residents. So the activity-based costing system that we're using is the Power Performance Manager, and each site will receive a technology pack, which includes the Contact Herald cards in the pre-collection period, along with training support with use, and the relationship managers will come on site to actually set the technology up. So besides going through the process on how staff pick up the cards and providing some information to the residents and their families, that is about the training that is needed. Now you'll see the coloured dots at the bottom. Every staff card has a coloured dot, and they're designated to the staff type. So RNs will have different colour to the ENs to the care workers, and that's because the actual resources invested in those different care types factors into when we're doing the costing. So every RN has the same card, every RN will have the same colour card, and they rotate it through the shifts so that we can allocate RN time to the residents that they support. Now, we want to make sure about data privacy and security, so protecting it, both the privacy and security of residents and staff is really the top priority. So any data that is provided is anonymised, and it's aggregated before we analyse it and report on it, so that every resident can ensure, as well as staff, that they cannot be identified through the study. So the data capture process is not intended to track movements of individual staff or residents. It's purely measuring the amount of care that is directly provided to residents, and by who, by what care type, staff type. So all data that's collected will only be used for the purposes of the residential aged care cost collection of 2024-2025, and the raw activity data collected from each participating site won't be shared outside of IHACPA or the Health Consult team. To ensure that we maintain these data protection protocols, all data must be uploaded via IHACPA Secure Data Management System, or the SDMS. Data is never to be sent through email, and if this does inadvertently occur, it will be deleted. And if any names, for example, are uploaded into the IHACPA's SDMS system, it's automatically deleted, and the home is let known that they need to re-upload it with no identifiable data. So what about the impact on resident staff? So look, the data collection process has minimal impact on residents and staff. Residents wear small cards or bracelets when mobile, or they can leave them on their bedside when they're in their room. Staff wear small roll-based cards, as I said, during their shifts. At the end of the shift, they put it back in the box. At the start of the shift, they pick it up. And residents or their family or carers can actually elect not to participate. For the purposes of costing a home, it is better that majority of residents do elect to participate. So part of the recruitment and onboarding process, we do ask homes to have those discussions with residents, and we're always available to answer any questions that they may have. Support for participating sites is key. We know you're all busy and you're fundamentally doing things that are more important than participating in a costing study. That's why, with the support of IHACPA, we have dedicated relationship managers for every site. You'll get to know that person. They will speak to the site manager as often as is required, for whatever help and assistance you need. We also provide a comprehensive suite of resources. This isn't a pile of paper. This is really information sheets that you could share with residents and family about what the study is about. It's a poster so that you can communicate to everyone in the home that 30-day live collection is actually happening, and there's contact information if they want to get in touch with either IHACPA or a health consult. The technology setup is done by Health Consult. We can provide training. Some sites have actually wanted to do it by themselves, and we can provide that support. And they really are as easy as setting up an iPad and unpacking cards that are all pre-labelled. And then we do provide that ongoing support provided throughout the whole data collection, so any questions are easily asked and readily answered. So just some key lessons that we've learned to date through 2024 so that we can be completely transparent about what being involved means. It's important for management to provide information about the residential aged care cost collection to residents and staff. Staff do ask questions about what it's all about and whether they're being tracked, and it's important that staff and residents are aware that this is really about measuring the cost of delivering care so that prices can be better informed by evidence-based data. It's important to have a site sponsor at each of the site that can oversee the day-to-day data collection, particularly through that 30-day period. We do have monitoring dashboards that the relationship managers monitor, so we can make sure that your cards are still active, and that if we notice that there is a gap in the data for a group of residents, for example, that we can get in contact and ask you to just follow up on a couple of things. The maximum amount of effort that's been required, even when a card has gotten lost in a washing machine, is about 20 minutes per day. And then there's about a half a day's work required to compile the resident site information and financial information for the study prior to and at the end. And the relationship managers are on site during the setup phase that can actually help and have been helping site coordinators to compile that information to make your life easier and ensure that we get great participation in the study. I also want to share a bit of information about a sort of a sub-study that we're also conducting. Costing studies are time-consuming for homes as well as people that run them. And so the future of costing isn't really about sending people in and technology to measure and record services. It's really about being able to use data that you already collect to inform the costing process. And so a lot of homes use health record management systems or HRMSs. And so what we're doing is a sub-study of the 200 homes that participate. We're looking for 30 homes that will participate in this sub-study. If you're a LeadCare or Telstra Health system user, then we'd like to talk to you about your participation. We do have just over 20 homes that have already agreed to participate in this. And, we also ensure that this study too, that all data will be anonymised and securely transferred so that there'll be no resident or staff privacy issues in transferring that data. So the way in which this works is, with your permission, data will be extracted centrally from your HRMS, minimising the workload on your team. So we're working with LeadCare and Telstra Health in order to do that once we get your informed consent. Once we have that data, we'll be able to analyse it and structure it in such a way that we can try and mimic as much as we can the data that we're collecting through the Bluetooth activity data collection. Now, your involvement at this stage, we expect to be up to 3 consultations to validate how the care activities are being delivered and resources and what we're seeing from your HRMS so that we can ensure that the final outputs accurately reflect your setting. And the Health Consult team will do as much to minimise the time required of your team. With that data, what we'll be doing is developing relative value units, and these will be co-developed to measure staff time and resources needed for each activity. So for all you that use the HRMS, there are a bunch of interventions that are done. They populate the care plans. Some are daily, some are ticked off, and there's a variety of mixes about the way the HRMSs are used. But we really want to work out how much time is required for certain activities and whether there are characteristics of residents that mean that time is going to take longer so that we can develop those RVUs. In terms of the benefits, so participants gain insights into their capability of their HRMSs. We'll hopefully gain some potential efficiency improvements, and it'll be an early look at informing what future costing studies will look like. So the HRMS data will actually be compared to the Bluetooth data collection, and so that'll help us verify accuracy and highlight any of the differences. So really, in terms of next steps, if you are a Telstra Health or a LeadCare HRMS user, then your involvement is really important. And we'll ask at the time of the recruitment what system you use and if you're interested in working with us to contribute to the feasibility study. So that is a lot of information to take in. I really appreciate your time and effort in listening, but we do really want you to get involved. And so we ask that you complete an expression of interest through the link. You can also scan the QR code. Any questions can be sent to IHACPA, or you can send an email to healthconsult@raccc2024-2025@healthconsult.com.au. And then we're on to questions.
Thanks, Lisa. If anyone has any questions, please feel free to pop them in the chat box and we can go through those. I do have a question for you, Lisa. So are there any resources or information that can be provided for providers to review before they decide to participate?
Yes, absolutely. Please just, even if you put an expression of interest, the first thing you will do is get some basic information so that we can inform you of what being involved is, and then we'll contact you in about 3 days after that short information pack to see if there's interested, or if you read it and love it, you can get straight back in contact and we'll kick off the process.
Wonderful, thank you. And just one more. So the aged care sector is already short-staffed. So if a provider does have any concerns about the impact that this cost collection and this reporting will bring on, what kind of support is provided?
Yeah, so we can provide as much or as little support as homes need. So it has varied. Some of the providers have needed, assistance in, populating Excel spreadsheets at the start, helping with information sessions for residents. But a lot of the providers have found it very light touch. And once they do the information session with the residents and the families and put some communication out in your newsletter, we do have a really short video that helps provide information about, in an easy format to digest, about what the costing study is involved. And we're happy to put you in contact with other providers that can talk you through the experience if that helps. We really have done everything we can to minimise the amount of burden for sites, and the relationship managers work really hard, and they've been able to, gain really great efficiencies throughout the process to make it as easy for providers to participate as possible. We know how important this data is, and we know how important the time is of providers, and so we really have, and we'll continue to do as much as we can to make sure it's as easy, and you can call me if it's not.
Just joining Lisa in the room is James Chen, sorry. He's the Director of Aged Care Costing at IHACPA. We'll just wait maybe a few more minutes to see if any other questions come through, and if not, we can probably close the session a little bit earlier today.
Yeah, I might just reiterate, because obviously, the time impost of providers is paramount and will actually weigh up whether or not you do participate. And really, the study is maximising the use of your ACFR and your QFR. So that has a lot of the information. The technology is set up and collected. We will help educate and inform both staff and residents with any questions, and we provide you with all the glossy brochures and electronic information to share in your newsletters. And then the information around sort of the resident list and your staff type, and that the relationship managers can also help while you're on site with that, so that your site coordinator who has been nominated really has her day sort of supported by a team that has done this in 100 sites to date. So it really has been made as simple as possible, and we really encourage as many people to participate.
All right. Okay, well, I think that might be everything. So there should be a little pop-up that comes up on everyone's screen. If you would like to express interest, please feel free to tick yes, and we can follow up with you there and provide more information. Otherwise, if you do have any questions that come up after you've had time to digest this webinar, please feel free to contact us. Otherwise, thank you everyone for joining us today.
Thank you.
Thank you.
See ya.